So, ladies and gentlemen, welcome back to the TCM community. And today our special guest is Jill Brown. Jill Brown is a licensed acupuncturist and Twina therapist, and also a QiGong Sensory Therapist. She's also the chairman of Stifting QiGongTherapy.com and an external for the Dutch Acupuncture Academy, the DAA. And she's also the co-author of Understanding, Managing, and Treating Female Infertility with Chinese Medicine. So welcome.
Thank you for having me. Hi.
No problem. We're happy you could join us today. I know you must have a busy schedule with all your projects. I know you're very passionate about family and health and education. And I was wondering, so you did acupuncture, but also did Twina therapy. What made you also go for Twina therapy?
When I was working as acupuncturist, I always had a feeling that I missed something with my treatments. Mm-hmm. I wanted to touch the people, mm-hmm. and not just to have an object between me and them, like a needle, for instance. So I wanted to use my hands as well, but it didn't feel appropriate. So I felt like I needed some extra professional training, how to be able to touch the people and to be able to provide some medical manipulations and treatments with my hands, not only with a needle. So that was one of the reasons why I studied Twina.
Okay, yes, you were drawn to the touch, the touch side of it, yeah. And I see you do a lot with pediatric Twina. You also specialized in that, right?
Yeah.
And for those of us who have no idea, what is QiGong Sensory Therapy?
QiGong Sensory Therapy it's 12 movements which are part of Twina Therapy, actually. Mm-hmm. So we use these 12 movements in usually 2 different ways with 2 types of pressure. And we work on the meridians and some acupuncture points. Mm-hmm. And what we're trying to do is to restore the senses of the skin, because the children with autism or sensory processing disorder, they have problems with their senses. And in Chinese medicine, we say the senses are the doors and windows. And children with autism, they often have the doors and windows partially shut. So it keeps them more in their own world or withdrawn. So we're trying to open these doors to allow a right amount of sensory information in and out. Mm-hmm, mm-hmm. Like a massage it's a Twina. So we're regulating the meridians. We're trying to bring some extra energy flow through the meridians, because we see a lot of blockages in the meridians, which cause either the skin to be either more hyper or hyposensitive. Mm-hmm. So with the different pressures, we're trying to regulate hypo or hyper sensitivity in the skin, which then allows a lot of other sensory information into them.
So basically this therapy is perfect for sensory processing disorder of disabilities, right? Because
it's perfect. Yeah, it's perfect. Yeah. And it sounds confusing because a lot of children with autism or sensory processing disorder don't like touch. Mm-hmm. So that's why we have to teach the parents in a way that they can touch the children, so it feels more pleasurable.
Do you also use oils in combining?
No, okay. Clothes. The kids are fully clothed. Mm-hmm, mm-hmm. Even some children, they wear a lot of clothes, like coats. Some do like you to touch their skin. Mm-hmm. So every child's different. Yeah. It depends, but we don't use any special oil or equipment. It's basically just our hands and the parents' hands.
Yeah. And it's not just autism, right? It's ADHD, ADD, sensory processing disorders in general.
Yeah.
Okay. So the parents come to you as how do I see it? Do you have a lot of parents coming in, like both parents or just single parents coming in? How does this work?
It depends. Sometimes both parents come, sometimes they bring their siblings, which I really like as well. Sometimes it can cause a bit more stress if they bring their brothers and sisters, and sometimes it has the opposite effect. It's really helpful. What I noticed, more mothers, they tend to come for the massage, because the fathers, they feel often that they're not as bonded as the mothers.
Mm-hmm.
And then I really try to encourage that I work more with the fathers than with the mothers.
Okay.
Yeah,
Yeah.
so it's important to create this bond. So if you imagine that touch is really difficult for a parent and child, then the bond it's not always great, you know.
Yeah.
So if, like I was talking about the skin, it's got like hyper or hypo
Mm-hmm.
sensitivities. So
Mm-hmm.
one part of the skin could feel really irritating when you touch it, and
Mm-hmm.
another part can feel numb. But if you don't know where that is in your child, you often get a strange reaction from a child when you touch it. It would pull away, then you would look at the child funny, then the child would look at you. So you have this negative sort of thing going back and forward, and you don't quite understand each other.
Mm-hmm. Do you see more boys or girls with sensory disorders in your clinic?
Boys. No, yeah, more boys. I think
Mm-hmm.
it's pretty close,
Okay.
I think.
Okay.
But I would say boys.
Mm-hmm. And I was wondering, so you're doing this session, basically you're training the parents. Is it like in the beginning, it's more frequent, and then once they know how to do or do you just keep making appointments with you?
No. So I do, well, I give the advice for children who are verbal, they need 10 sessions,
Mm-hmm.
and non-verbal children, 20 sessions. But I always book a 10-session treatment, and then we reevaluate after the 10 sessions if they do need more, because I think it's a waste just to book 20 sessions and maybe you don't need them.
Yeah.
So I do the training with the parents, which takes about 3 to 4 hours, and we practice on both parents so they get to feel the different sensation of what it's like to have a good massage or a good treatment or a really bad one. So they can also feel if the pressure's too heavy, what it feels like, or if the tapping is too strong, what it feels like. So you really get in tune with how you're treating somebody and how it feels for you.
Yeah.
It takes about 3 to 4 hours. And then I do that without the child because we don't want to be practicing on a child.
Mm-hmm.
And then I see the parent for 10 consecutive weeks with the child, so once a week. And I train the parents to read the body language of the child, because the child's not always verbal. So we need to know what is uncomfortable for the child, what feels good. And
Mm-hmm.
we work in that way. So over 10 weeks, the parents should be able to understand how to massage their child appropriately, and how to change the massage due to the child's reaction to get the best result.
Yeah. Okay. What age group is the most frequent? The children in question, is it like 7, or do you also get teens or older?
Yeah. I get teens as well. Usually starting around 4.
Mm-hmm.
I think the youngest child was probably 3, had quite severe sensory issues. Going up to 16 is what I've trained with the parents, and I've treated some adults, but it's different because then they don't have a parent who's treating them at home, so they would just come for one treatment.
Yeah.
But it's completely different to being treated every day by the parent. It's the parent needs to treat the child every day.
Yeah. Okay.
Themselves.
Yeah.
So what I like about it is after the 10 weeks, the parent isn't reliant on me anymore. They are their own child's therapist in a way, which is really good because it creates a better bond between them and causes a lot less stress than taking your child to different therapies.
Do they also keep in touch after that?
Yeah.
Like give you feedback, or how's it going? Okay.
Yeah. So I'm WhatsApping them
All right.
to see how it goes.
Yeah.
It's a really nice journey. It's very different to acupuncture. With acupuncture, it feels there's more like a professional way of dealing with people. But when I'm working with a family, it's really intimate. and you don't remain like with a distance. You get really close to the family. It's really nice.
Yeah. You have this special bond with that family.
Exactly.
So that's why I thought, if they keep you informed even after the 10 or 20 weeks or whatever.
Yeah.
Do you also hear success stories after that? So let's say a couple of months after they've been, you get like a progress.
Yeah. So the way the therapy works, it takes about 1 to 2 years of everyday treatment from the parent to really reduce the sensory overload from the child. So it needs to be done every day for 1 to 2 years. So it's quite a long time, but it's definitely worth it. It's you see improvements all the time.
That's great. Yeah. And you also set up the Stifting QiGong Therapy, right?
Yeah.
Could you tell us something about that?
I wanted to start up a Stifting when I was a student, when I finished actually, because I was in training and I saw a woman, she needed a lot of treatment. She didn't have enough money and she had to stop treatment. She had a lot of pain. She brought, I think, like 3 or 4 grandkids with her. She was cleaning houses and taking these kids with her. And it really upset me to see this woman in a lot of difficulties and she couldn't afford treatment. So I tried to set up a charity and work with the Salvation Army here and with the Futsal Bank to try and offer like 1 or 2 days a week where I could go and I would treat people who really didn't have any money. But I just couldn't do it. It was so difficult. It was really difficult. So then 5 years later, I met a woman called Mabel, her children were patients of mine. So I was training her this technique. And this woman, she's from Ghana, and she's here working for the Ghana Embassy. She's also now studying acupuncture at the Dutch Acupuncture Academy.
Okay.
And she will return to Ghana, and she will open up like a nursery for children with autism and sensory processing disorder. But she was a bit stuck as well. She's like, to do all these things on your own, it's so difficult. So I was telling her when I tried to set up another Stifting, and I said I felt the same. I was on my own. I had no support, and it just didn't go anywhere. So now we started talking a lot, getting excited, and we want to do something in Ghana. We want to, we really want to bring this therapy to Ghana.
Okay, so that project is ongoing. You're still working on that.
That's ongoing. She needs to finish her studies.
Oh yeah, okay.
In the meantime, she is setting things up there while she's here. All
right, sounds great.
Yeah.
Is there any case that you want to share that really stands out, like groundbreaking?
Groundbreaking, it's all groundbreaking. Any step in the right direction when you've got a child with autism and sensory processing disorder is groundbreaking. Every improvement, every step, every time the child sleeps improved, digestion's improved. Young children I have experienced where they are non-verbal and they start to talk. I have more of a challenge with teens who are non-verbal. So far, I haven't been able to help a teenager who's non-verbal start to talk. But with young kids, yes. But I still see big improvements in teenagers when I work with them. So something which sticks out is at the very beginning when I was doing my training for this, I was working with a family and I was working with a non-verbal, I can't remember how old he was, 3 or 4, child, he had severely autistic, his diagnosis, and sensory disorder. And he had diarrhea, which was about 7 times a day. And his mum took him to the doctor, and the doctor said, your child's autistic. What do you expect? They often have digestive disorders. It really upset me. Like I treated that child for, I think it was about 4 weeks, and he had no diarrhea anymore. This child had always had diarrhea. He was incontinent. That really stuck out, like how some doctors view autism, that it's a fixed, it's not malleable, you know, it's fixed. Autism, you can't really improve it, but they're so wrong. Just by reducing stress already reduces sensory disorders.
Of course. And you only used a Twina therapy for that specific case?
Only Twina therapy.
Yeah, okay.
I mean, so actually all digestive, so with all constipation, with all diarrhea, every child has had really great results with just the QiGong therapy. All the kids that I've treated have had really great results. They've all had great results in sleeping, in making eye contact, with social development. So you need these sort of foundations to start with the social development. Touch is really important. You can't have a good social development if you can't stand to be touched, because you miss so much information. If you can't stand to be touched, you don't look at people in their eye. You miss a lot of valuable information when you don't make eye contact. If you don't sleep, if you've got diarrhea, all these things add up to making a child a lot more stressed. So we work on the foundations before the child is able to learn. Language is the most difficult for the child to grasp. So first it would be digestion, sleep, their tantrums reduce, they have more social awareness, and language is usually the last. Although not always it's like that. It's where language comes quite quick. Every child's different.
Yeah, every child's different, and also, like you said, like every little improvement is basically groundbreaking. So it's just baby steps. And I guess it also helps because you're working with the parents, and the parents know their child, so they feel and pick up on these little improvements quickly, the parents, I mean. So that also helps, right? If you're
yeah and no. So I do have a weekly log where the parents fill out 2 days before they see me. So they give me an overview of how it's been throughout the week. But parents with children with special needs, they have 4 times higher cortisol levels. So a lot of things are missed because they're very stressed themselves. So it's nice that I keep this log, and then I can show them how it was when they started. I also do a pre-evaluation and evaluation like test. So the parents give all their scores before, they answer a lot of questions, and then at the end I do the same, so we can have a good look and see what else needs improvement. But parents are stressed, so they can miss some things, you know. So working with the parents is really important to support them.
I can imagine the parents could also use treatments themselves.
Yeah, I think it's really important that the whole family sort of is treated. And I think that's what I really like about this QiGong, because the parent doesn't have to lie on my table to be treated. By massaging their child, they're also stimulating their own senses, which also helps them to calm down and to relax. Bonding with their child helps a parent calm down and relax. So basically they're also treating themselves in a way. Taking 15 minutes a day with no interruptions with you and your child is it's healing, I think.
Yeah, it is healing, and it creates a special bond which maybe they didn't have in the beginning. It's amazing stuff, and I wish we had more time, but I mean, we could talk about this all day. And how do you look at combining QiGong Twina therapy with acupuncture? You often do that, or you specifically don't? Or
I do it sometimes, but I try not to do it because I want to teach the parents that they can help their child themselves after I've gone. But in really acute cases, sometimes I will use an acupuncture needle. I guess it's like treating the symptom and the root. You know,
Yeah,
sometimes you do have to treat the symptom before you can go to the root cause. For instance, a good example is I've treated a child who has a very hysterical laughter, and she wasn't sleeping, and she was laughing all day and basically often through the night. So with Qigong alone, it would take some time to help the child, but with acupuncture, it helped quite quickly. So then in cases like that, I would combine, but I really try not to. I really try to give the power to the parent.
Yeah. It's a fantastic project, and for now, it's not reimbursed, right, by the
Twina
insurance.
Some Twina is reimbursed by some insurance.
Yeah.
And yeah.
Okay.
Yeah. Twina Therapy. Yeah. Not all. They did change it a few years ago.
Yeah, because that's what I thought.
Yeah, but there's still some insurers that do reimburse it. And QiGong Therapy is Twina Therapy, actually.
Yeah. So,
only 12 movements of Twina, so renamed as a QiGong Sensory Therapy.
But I mean, this is such a great project. We should make more, government should make more of an effort to do to reimburse people and get everyone should be able to do this therapy.
Absolutely, but it is really behind because I treat a lot of kids, obviously, from the special needs school. And diet is really important in my treatment.
Yeah.
And the diet in these schools are Nutella and white bread. They have Nutella and white bread on the tables for the children to, they have a jug of juice. So it's, so if you're feeding your child sugar, who has a lot of hyperactivity anyway, it's, there's a lot that needs to be improved. And a lot of education needs to be put out there.
Yes, definitely. It's a challenge, but that's why we're happy with like people with projects like yourself, and that's why we're trying to promote this through these TCM channels. That's what the TCM community is for, to promote the health benefits of traditional medicine and make it more accessible and affordable for the general public. Yeah. So again, I'd like to thank you for having enlightened us with your information, and hopefully we'll see you again next time.
Yeah, it'll be good. See you next time. Thank you.
Okay, no problem. Okay. So thank you, and see you again next time on the TCM community. Bye-bye.
Bye-bye.